Welcome to a seismic reckoning raw and filtered dive into the silent crisis hunting every American over 50. This isn't a gentle lecture. It's a battle cry, forged from 60 years of relentless research by Harvard Medical School, the National Institutes of Health, the Centers for Medicare and Medicaid Services, and the Social Security Administration. Picture this. A clock ticks past midnight on your 55th birthday, and three specters rise: Medicare, Social Security, and senior living near me, not as saviors, but as riddles wrapped in fear. Data screams the stakes. 92% of Americans over 65 rely on Medicare, yet 1 in 3 dreaded scabs, per CMS 2023. 88% depend on Social Security, but 60% fear it won't suffice, per SSE 2022, and 70% search senior living near me. Yet 45% tremble at the cost or quality, per ARP 2023's survey of 15,000 seniors. These aren't mere statistics, they're the pulse of a generation teetering on an abyss. But here's the vow: every terror has a conqueror's science, strategy, and resilience will light the way. Stay sharp, because this journey is brutal, beautiful, and yours to claim. Let's plunge into the first abyss. Medicare, the lifeline that promises health but delivers dread. Envision a hospital bed, sterile and cold. 92% of seniors lean on Medicare, yet 1 in 4 face uncovered, costs averaging $6,800 yearly. Per Kaiser Family Foundation's 2023 analysis of 10,000 beneficiaries, a 67-year-old widow once clutched a bill, whispering, "This will bury me before cancer does." The fear isn't coverage, it's the holes. Prescription drugs, dental, vision, long-term care, all lurking like traps. A 2022 NIH study with 8,500 seniors found that 35% skip medications due to cost, spiking hospitalization risk by 28%. Another layer: complexity. 68% misunderstand plan options, per CMS 2023, leaving 1 in 5 uninsured. The terror peaks here. Illness doesn't kill, ignorance and gaps do. But science and strategy strike back hard. Start with Medicare Advantage. A 2021 Harvard study of 12,000 enrollees showed these plans cut out-of-pocket costs by 40% versus original Medicare, covering extras like dental and vision. Picture a $200 dental bill shrinking to $80. That's real. Next, Medigap. A 2023 CMS report on 9,000 seniors found supplemental plans slash uncovered expenses by 55%, dropping annual costs to $3,000. Add preventive care. A 2020 AMA trial with 7,500 seniors proved annual checkups reduce emergency visits by 32%, saving for $1,200 yearly. The arsenal. Research plans. 30 minutes on Medicare.gov cuts confusion by 25%. Per ARP 2022, enroll in Advantage or Medigap by 65–80% who do save $5,000 over 5 years. Per Kaiser, get screened yearly 1 in to catch issues early. Per NIH, Medicare isn't a maze, it's a weapon. Wield it now. The second specter. Social Security, the lifeline that promises stability but whispers ruin. Imagine a mailbox, check arriving. 88% of seniors rely on it, averaging $1,827 monthly in 2023. Per SSA, yet 60% fear it's not enough. Per AARP's survey of 14,000 retirees. A 72-year-old man once stared at his $1,500 check, saying, "This won't cover rent, let alone life. The dread is mathematical. $1,827 meets just 40% of basic needs for 1 in 3. Per BLS 2022's Cost of Living Index. Worse, 45% fear cuts at 2023 SSE projection warns a 20% reduction by 2035 if funds dry. The terror doubles. Poverty looms and time shrinks. Yet, resilience rises fierce and calculated. Delay claiming. A 2021 SSA study with 10,000 beneficiaries showed waiting till 70 boosts payments by 32% to $1,411 monthly versus $1,827 at 66. Visualize $7,000 extra yearly, that's survival. Pair with part-time work. A 2020 to BLS report on 6,500 seniors found 15 hours weekly at $15. Our adds $11,700 annually, lifting 70% above poverty. Add savings. A 2020 Fidelity analysis of 8,000 pre-retirees showed $500 monthly in a 401k from 55 gross to $150,000 by 70 at 6% return. The Toolkit. Wait till 70, 85% to avoid financial strain. Press SA. Work 10 to 15 hours one in to bridge the gap. Per BLS. Save $200 monthly, 60%, build a cushion. Per Fidelity. Social Security isn't a crutch. It's a springboard, leap wisely. Here's the third abyss. Senior living near me, the search for sanctuary that unearths panic. Picture a browser open. Options swirling. 70% of seniors Google this, per Pew Research 2023. Yet 45% fear costs for $1,500 month for assisted living, per Genworth 2023 or Quality One in. 3 reports are par care. Brenner H 2022's audit of 5,000 facilities. A 69-year-old once toured a home, muttering, "This smells like despair." Not dignity. The dread triples. Affordability. Safety. Isolation. 65% fear losing autonomy. Pre-ARP. The crisis peaks. Home isn't home. It's a cage. But solutions surge bold and precise. Start with aging in place. A 2021 NIH study with 9,000 seniors found home modifications ramps. Grab bars cut care needs by 38%. Saving $20,000 yearly versus facilities. Add CCRC's continuing care retirement communities. A 2022 AARP report on 7,500 residents showed these blend independence and care, reducing isolation by 30% at $3. 0. Month 33% cheaper than assisted living. Explore co-housing. A 2020 Stanford trial with 1,200 seniors found shared living drops costs to $1,800 month and loneliness by 25%. The playbook. Modify homes 75% stay independent longer. Per NIH. Research CCRC 60% rate them high. Pre-ARP. Try co-housing one in to thrive. Per Stanford. Senior living isn't a trap. It's a choice, sees it. Here's the twist, a knot tighter than steel. These 3 aren't separate. They're a trinity of terror. A 2023 CMS report on 20,000 Medicare users found 50% fearing gaps, also dread social or security shortfalls, one in to link health costs to poverty. A 2022 SSA study with 15,000 claimants showed 40% fearing cuts seek senior living, yet 55% can't afford it. A 69-year-old once sobbed, "No Medicare for my eyes, no Social Security for rent, no home I can trust, I'm drowning." The abyss deepens. Each fear fuels the next. Vortex of despair. Is there a lifeline? Science rules yes, but the climb is steep. Let's unravel this crisis with a survival guide, not platitudes, but precision. For Medicare, master the system. A 2023 Kaiser study of 11,000 seniors found 80% who compare plans yearly save $3,500. Ignorance costs more than illness. For Social Security, stack income. A 2021 BLS survey of 7,000 seniors showed 65% pairing benefits with $10,000 yearly work income live comfortably. For senior living, plan early. A 2020 NIH analysis of 6,500 seniors found 70% research options by 60 avoid panic moves, saving $15,000 over a decade. The proof. A 71-year-old did this Medicare Advantage cut her costs 40%. Delayed Social Security added $8,000 yearly. Co-housing saved $20,000. She's thriving. Not sinking. This isn't survival. It's conquest. A 2023 study of 25,000 seniors globally found that mastering these three boosts life expectancy by 15%, 10 to 12 years of vigor. Start today. Check Medicare options 30 minutes, saves thousands. Delay Social Security 1 year, 8% more monthly. Per essay. Tory CCRC1 visit shifts the game. A 66-year-old once said, "I fear the abyss. Now I rule it. The call is yours. Act now. Share your fight in the comments. This isn't theory. It's life. Conquer the crisis. The golden years are yours to claim."